Welcome back to my channel. If you're new here, my name is Neil Galve and I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already subscribed though, thank you so much for your love and support. I see you. I upload my nursing educational videos twice a week. Please make sure to subscribe now. Hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everyone! Welcome back nga sa channel ko. I know that it's been a really long while since the last time I uploaded a video, but I just want to apologize from the bottom of my heart to everyone, to all of you, for not being able to upload lately. I was a little bit in a hiatus moment of my life. But I'm pretty sure that you guys understand. Apart from that, I just really want to grab this opportunity to thank you for keep on supporting my channel despite of me unable to upload lately. I can see that our channel is really growing and we are now more than 23,000 subscribers. Welcome home sa mga welcome home nga po sa lahat ng mga bago nating ka-Team Galve na naandyan. Maraming salamat po at sa mga datihan na at patuloy na sumusuporta at nandyan pa rin, nananatiling nandyan. Maraming salamat po. Yes, today like you see is another entry natin sa ating nursing pharmacology. We are going to talk about this guy right here. This is your Midazolam. You see? Midazolam, and let this be your nursing drug study guide sa pag-aaral mo para ma-master mo yung concept ng Midazolam. Now, if you haven't watched the other nursing pharmacology videos I created or lectures I created on my channel, I'll be putting the actual playlist link on the description box, or whenever the icon button pops out, check the one out because it's all gonna be there together with the other playlist I have on my channel. O diba, na-miss ko to? Na-miss ko po siya. Anyways, I am going to discuss to you now Midazolam, and just like the other nursing drug study, this is going to be quick and very efficient para ma-manage natin yung time natin, diba? So, okay, let me zoom you out. Alright, so in this drug study about Midazolam, we are going to answer the following questions or concept or categories under this medication. We're going to study about the drug class. I'm also going to walk you through about the mechanism of action, the indication of this medication, contraindications, adverse reaction, and this will not be a nursing drug study if we're not going to talk about your nursing interventions. All of that in a bit, so kalma lang tayo. Before that, I'm going to give you time, if you haven't already, to subscribe now. Alright, di ba ang bilis? Ganun lang kabilis mag-subscribe, day. So, subscribe na. Alright, so simulan na natin to. Midazolam, your nursing drug study. First up, we are going to discuss about the drug class. This medication is what we called, let me change my pen color here to this one para may tama. Ayan. So, this is called your benzodiazepine. Drug class ng Midazolam mo is benzodiazepine. Kung familiar kayo, kung nakahandle na kayo ng Midazolam before, if you were able to administer this type of medication, I'm pretty sure that you know this. These are medication under the drug class benzodiazepine. Next, mechanism of action. How does this medication works? As you can see, guys, Midazolam acts on the CNS. When you say CNS, that is your central nervous system that involves your what? Your brain and your spinal cord. So, acts on the CNS to produce a generalized CNS depression, meaning it is the type of medication that will decrease the function of your CNS depression. Okay, once again, Midazolam acts as to produce generalized generalized CNS depression. Malinaw tayo doon? Malinaw. Now, how about the indication, you guys? When you talk about the indication of your midazolam, this is pretty easy. I list down 2 here. So, this is, by the way, IV indication. There's some other there's some other routes of administration for your midazolam, which you're going to tackle in a bit. But for now, I want you to focus on the indication of midazolam in terms of IV administration. All right. So in terms of IV, what we have here is it aids in induction of anesthesia. So midazolam is typically used as a sedative for any painful procedure to our patients. Let's say if you're working in the ICU, your patient is going to be intubated. Your patient is going, or the doctor wanting to do some bedside procedures, such as it could be like central line insertion. It could be like upper bronchoscopy, or it could be like lower endoscopy or upper endoscopy. Whatever painful procedure that your patient in the ICU is having, this medication is actually indicated, normally given to them to produce generalized depression in the CNS area of the body. Next, you have for continuous infusion, provide sedation for mechanically ventilated patients. This is very true. To those nurses who have ICU experience, just like me, hello guys, kaway-kaway tayo dyan. Midazolam is one of the common sedative that we give to our patients who are on mech vent, who are intubated and are connected to mechanical ventilation. If you haven't watched the video, segue ko lang, if you haven't watched the video that I created under mechanical ventilation, some common setup, and the sedation ICU drips that I created, I'll be putting the actual links under the prescription box, or check mo yon, or kapag nag-pop out nga yung icon button, click the one out. But for continuous infusion, provide sedation for mechanically ventilated patients. Normally, you will see midazolam given together with fentanyl, because it enhances the absorption of fentanyl in the patient's body. So just remember lang, let me just remind you, whenever you have patients who are ventilated and is on any type of sedation, the only way for you to actually measure the effectiveness of the midazolam or fentanyl or whatever sedation you're using, it could be propofol, is to use your Richmond Assessment Scale. RAS score, Richmond Sedation Scale, RAS. Okay, so normally the typical RAS score that we want to achieve to a patient is -1 to 0. Alright? So, malinaw tayo. Are we clear about indication? Very good. Now, we're going to proceed to your contraindications. To which patients are you not going to give midazolam? These are the answers. First one, we have your cross-sensitivity to other benzodiazepine may occur. Meaning, if you have a patient that is have any allergy to any benzodiazepine and its derivatives, no po ang midazolam. Don't administer. That's why it's very important for you to have a complete, thorough nursing assessment. Alright, next one is shock. So I list down here some of the types of shocks: hypovolemic shock, neurogenic shock, anaphylactic shock, septic shock, cardiogenic shock. Why are you not gonna give benzodiazepine to patients who are in a shock state? Why? Because especially if it has something to do with your, such as this guy, the neurogenic shock, remember that midazolam is actually produces what? CNS depression. CNS depression. And when you know that when you talk about shock, anything is going down. If you want to introduce something that will further aggravates the depression of your CNS, central nervous system, your patient might be deteriorating very quickly. So we don't want that. Of course, we want to reassess the patient from time to time. We want to make sure that it's really indicated and it's not something that is contraindicated to your patient. We want to reach that therapeutic effect to the patient as much as possible. All right. So what are the other contraindications of your midazolam? Listen up, you have your pre-existing CNS depression. If you have patients who are, let's say, stroke or any type of what's this, subarachnoid hemorrhage, any type of CNS disorder or illness, you want to make sure that you double check the indication of that patient prior to giving it to the patient. You will want to check with your physician if this is really indicated to your patient, okay? Because we don't want to aggravate the CNS depression that the patient is already having. Okay, malinaw tayo doon? We clear? Good. Now, last contraindication that I have here is uncontrolled severe pain. You definitely don't want to give midazolam to your patients who have been experiencing severe uncontrolled pain. Are we good? We are good. All right. So, last two parts na nga tayo ng ating discussion. I'm gonna give you just a quick time for you to subscribe if you haven't already. Thank you so much. There you go. That's pretty much appreciated. Next, we have the adverse reaction of midazolam IV. Alright, so adverse reaction in terms of your CNS per ano po to I did it in per system. So let's start with your CNS, your central nervous system. So adverse reaction, you can expect that the patient is not responding well, meaning adverse effects and side effects are different, you guys. When you say adverse, these are the effects that are or that will tell you that the patient is not having the therapeutic effect that you want. When you say side effect, that is what? Very good. That is the type of effects that you are expecting from a patient who is on midazolam. Ano-ano ba yung mga example ng side effects of midazolam or patients who are in midazolam IV? You can expect them to be a little bit drowsy, lethargic, those stuff. But if you see these symptoms to your patients who are in the midazolam infusion, you can expect that these are the types of you can assess and you can tell that this is an adverse reaction of the patient towards midazolam. CNS, first up, suicidal thoughts, agitation, drowsiness, sedation, headache. Those are the adverse effect in terms of your CNS. How about for your cerebrovascular? It talks about your heart, cardiac arrest, arrhythmias. If you see any changes in ECG during administration or while the patient is on midazolam infusion, you can check with your provider right away and to rule out any arrhythmias and to correct it as quickly as possible. Lalo yung mga fatal arrhythmias natin. Alright? Now, in terms of your ears, eyes, nose, and throat, EENT, you can expect or patient might be having adverse reaction if he or she is complaining or verbalize blurred vision, especially if before the patient have, let's say, 20/20 vision or some kind of those stuff. Okay. Next, in terms of your respiration or respiratory system, if your patient is having apnea, laryngospasm, bronchospasm, respiratory depression, you can tell right away that the patient is having adverse reaction. Remember po, every time that you will administer midazolam, your eyes should be on the RR of the patient. Especially, let's say, for example, you're giving this on to the patient for IV push. Your eyes should be on the respiratory rate of the patient because the big side effect or adverse reaction of midazolam, major side effect is what? Respiratory depression. Eyes on the respiratory rate, eyes on the oxygen saturation of your patient. If you notice that the patient is having started to have apnea, laryngospasm, difficulty in breathing while you are giving the medication, you have to stop the administration of medication and refer accordingly to your provider. All right? Are we good? So once again, these are the adverse effects of your or adverse reaction of your midazolam. last step na nga tayo sa ating discussion for today, and we have your nursing interventions. Alright, so I list down here 4 major nursing responsibilities that you should know prior, during, and after administration of your midazolam. First one, you have to assess the level of consciousness, level of sedation. And how are you going to do that? Using your Richmond Assessment Sedation Scale, or Richmond Agitation Sedation Scale, RAS. Actually, doon sa discussion ko ng during my discussion of your sedation drips, ICU drips, sedation, I actually tackled about RAS, Richmond Agitation Sedation Scale. So please watch that out because it is good for you, for your learning. Assess level of sedation. Because why do you want to do that? Because you want to make sure that you are reaching, or you're still within, or you're achieving the therapeutic effect of midazolam. You don't want to give too much midazolam to your patient. Why? Because especially for elderly, because they may it can cause respiratory depression, and we know that patients who are old age have sometimes low tolerance to these type of medication. Next, assess LOC, level of consciousness. It's very important for us nursing or nurses to make sure that we have a baseline level of consciousness, baseline GCS. Once you receive a patient, that's going to be your your parameters to know if your patient is deteriorating in terms of his or her level of consciousness. Let's say you receive your patient alert, conscious and coherent, GCS 15, 4, 5, 6. So 15. And then at the mid of your shift, the patient started to be responsive to voice. Now the GCS goes down to 12. That is going to be an indication for you that your patient is starting to have decreased level of consciousness based on your baseline GCS and level of consciousness assessment. All right. Next, monitor blood pressure, heart rate, RR during administration. I kind of talk about this before, but I would just like to really emphasize this. During the administration of your midazolam, your eyes is going to be on the cardiac monitor, checking for your blood pressure, your heart rate, your RR, and your autosaturation, because of the adverse reaction, which is, in terms of your RR, respiratory arrest or respiratory depression. Are we good? Are we clear about that? Very good. Now, last nursing responsibility is oxygen and resuscitation equipment should be available during IV administration. Very common sense. Why? Because since this patient, or since you're a registered nurse, very highly skillful nurse, that this medication that you're going to give to your patient will introduce or could have a respiratory depression effect to your patient and could be fatal. You want to make sure that you are Girl Scout or Boy Scout. Your oxygen and resuscitation equipment, such as, if you're working in the ICU, we normally have intubation tray, which have all your ETT tube, airway adjuncts, airway therapy administration that you can give, from nasal to non-rebreather face mask. It's all there. So you have it. You want suction tube, suction catheter. All of it should be ready prior of administration of your midazolam. So that when the time comes, hindi naman po sana mangyari, we don't want it to happen, but we want to make sure that if the patient, in the event that the patient develops any respiratory depression and you have to intubate, you can actually perform it without any delay. in the procedure. You know what I mean? Does that make sense? Very good. Once again, that is pretty quick, and this is all about your Midazolam nursing drug study. Now, I just want to make sure that everybody was following. So, if you have a moment to take a screenshot of this, or if you actually want a clear copy of this, let me know, because I'm planning to send this or give this to my Patreons. Wow, o, diba? For free. O, diba? Malinaw tayo dyan? Yes, and let this be your nursing study guide nga sa pag-aaral mo ng Midazolam. Now, thank you so much for watching. I hope you learned something for today, and welcome back to me. Welcome back to us. I'm finally back. Thank you so much for watching. Tulungan nyo na nga ako, ipamalitan nyo na sa Radyong Sira, pinakabago, pinaka-fresh at pinakalibreng nursing review center sa balat ng YouTube. Don't forget to follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. Whenever you share my videos on YouTube to your social media platforms, please tag me just so I know and I can thank you personally. Maraming salamat po, and you have a good one.